Hey guys, Andrew, welcome back to the channel. So, finally went back to the physio. Just wanted to do a bit of a life update and where the channel's going in the new year. So, first thing, physio. Went to a disability specific physio. Test results are in. I am hypermobile. We don't know about Ehlers-Danlos syndrome yet. Still doing the genetic testing. So, guys, I'm going to be doing the physio and the balance programs a lot more. For those of you who've been following the channel long term will know that a couple of years ago, no, last year, sorry, memory issues, I got COVID, and it's been a very long road back to even some sort of semi-balance of health. Also have Sjogren's syndrome, ADHD, brain injury, peripheral neuropathy. I try not to let them get into my life a bit too much, but they do impact me, and so I do have access through the NDIS to two care programs, care agencies, sorry. So first one is my housing, which I've been asked to not mention their name because I live with housemates who are both under public guardian, so they can't be mentioned on any media. Then Semlo, who are happy to be mentioned and happy to have some of my team, some have opted out when I'm doing the vlogging style videos on camera. So guys, they are my community access team, and I'm going to be going into their day centre and doing their day trips a lot more. So, but let's get back to the physio. So I'm going to be doing a concentration program, a chronic pain program as well. And can I shout out to this physio and Better Movement Clinic Toowoomba, who, oh my God, their physios get chronic pain. It's not just we can't do anything. Are you resting? Are you doing yoga? It's no. Are you doing exercises? What type of exercises? Where is the pain? They have got a really great program called This Way Up that talks about chronic pain, has some reading, has some exercises, has some mindfulness that I could do. And for the first time in a couple of weeks, I actually slept through the night because I also have epilepsy and have parasomnias. So that's basically sleepwalking, sleep eating as well. So I was able to focus a lot more today as well. So, guys, I know that a lot of people are doing a lot of disability education and talking about accessibility, the NDIS, and the fight we have in the NDIS. But I think we all need to take 3 steps back. Yes, there's a massive fight on the NDIS cutbacks of having navigators instead of support coordinators or LACs. But, guys, we need to be grateful that we even have a care program, that we're not just warehoused in a care home where the ratios are horrendous. I still do know that support workers are undertrained in some houses, that they're using restrictive practices in an unauthorized way as well. I know that there's not a lot of recourse for that as well. But guys, let's touch on something that I've tried to stay away from, and that's toxic positivity. So that toxic positivity is where your everything is fine and denying your reality of being in pain, having a disability, having a chronic illness, needing support, needing care, needing help with housework. All of those things that the NDIS at the end of the day are designed to help with. Yeah, I've gone through 3 agencies before I found the right fit in community access for me. I thought I could live on my own completely independently. Couldn't do it. Thought I could do it with drop-in support. Couldn't do it. Had some health issues. Cost my parents and family a lot of money in having to pack up my unit. In 2001, so COVID restrictions were still happening. Got very depressed, mental health issues, and then finding where I am now. there was a lot of ups and downs. But what I want to talk about more is that balance and contentment. And that contentment is understanding that, yeah, there's going to be negatives, there's going to be positives, but realizing that when we have that gratitude of there's food in the fridge, we have clean sheets on the bed, we have clean clothing, we have money to pay the electricity bill, we have someone to talk to, we have care, we have access to speak up and change our care teams if things aren't working. We have access to hire or reuse assistive tech, which is amazing. And guys, this is where it gets tricky around contentment and gratitude, is that some people do, unfortunately, I've seen, use their disability as an excuse to treat people very badly as well. I know that sometimes I can't help what I'm saying or what I'm doing, but I do try to accept that my disability is an excuse and I can't have things both ways. But I'm seeing a lot of people saying that because they don't have access to the doctors, the mental health professionals, or whatever, they're going online and diagnosing themselves. If you haven't checked it out, check out my Hills I Will Die On video. I talk a lot more about why I fundamentally disagree with self-diagnosis. But what it boils down to is that I've had medical professionals misdiagnose me. They've got years of medical training. So, with those of us who have the lived experience, yes, there are some cases where doing the self-diagnosis, doing research on the internet is valid, but because of that mistrust in doctors, they're not putting in the research and time and effort, and quite simply, they're overwhelmed. We're not training enough Australian trained medical practitioners. But guys, you need to trust your health professionals and find a way to get diagnosed. And the other thing that I've seen, particularly on Reddit and TikTok, is people complaining that they've spent all of this money on the diagnosis and then they can't get into the NDIS. Guys, diagnosis does not equal access. So, guys, again, diagnosis does not equal access. It is how that disability, health condition, or impairment impacts your life. So if you have autism and you are able to live and to work and to keep your house clean, you may not get access. But if you are lower functioning and need support to get out of the house, regulate emotions, to cook and to clean and to keep yourself hygienic, yeah, you're probably going to get access more. In my first time, got knocked back. Then I went to a professional advocacy organisation who knew the wording, who knew the keywords, and I was accepted. So, guys, if you can't afford all of the report writing and then the evidence gathering, go to an advocacy agency. But remembering that it's not about the diagnosis, it's about how the diagnosis affects your life. And there's a lot of people who are very stunned to find out that some of their conditions that they consider a disability in the NDIS world are considered a health condition. There is health-related support. I get them for my epilepsy and my ADHD, but they're the two that spring to mind about epilepsy and ADHD are primary health conditions. So if they can be managed through medication and psychotherapy, they're not going to fund it. And we need to draw a line in the sand of, okay, where does the funding go? Where does the taxpayer funding go? Does it go into disability care bucket, or does it go into healthcare to look after these people? And the other thing is that we're having a massive debate around is the role of support workers and the role of disability, but in that conversation, the role of the state government, because the NDIS was always supposed to be a two-tier system and the state looking after the rest. And unfortunately, law of unintended consequences, all of those state and community-based access programs, I know some work-ordered programs, some sheltered workshops and supported workshops. If you didn't have NDIS, you weren't accepted. They did help their current clientele to get NDIS, but they have disappeared. And so it's the NDIS has created a two-tier system. You might have heard people talk about the gentrification of disability. You can't gentrify a disability, but you can gentrify a class of people who have got the funds to get diagnosis, to get the support, to get the help as well. And so those who don't have the money to get a diagnosis are left behind. And I know I'm talking from two hats here, going, I don't agree with self-diagnosis, but I do understand where it's coming from. But guys, I'm seeing so many people who are faking diagnoses, and it's really important to get the right diagnosis so you can get the right treatment as well. Because I'm seeing so many people, particularly over on TikTok, it seems to be a TikTok thing, that they're thinking that ADHD is cute and quirky, that it doesn't destroy relationships, that it doesn't destroy your mental health, that it's not a major issue. Guys, it's a major issue. Some of the things that I have said and wish I could take back. Yeah, guys, it's due to the ADHD, and actions have consequences. People are thinking that depression and mental illness is an aesthetic, when all it's doing is fueling a mistrust of when people say that they're ADHD or autistic or have seizure disorders, whether that be seizures of epileptic origin, FND, or of no known origin as well. So, guys, this is where it is a hill I will die on. And I know I've lost subscribers over this. Guys, that I fundamentally, in my core, disagree with self-diagnosis because of the harm it creates in the disability community. And I know I've also been called a gatekeeper for that. And guys, I will wear that badge with pride because in the disability community, there is a shared trauma of fighting for a diagnosis, fighting for accessibility, fighting to have what we need provided to us without being seen as the asshole in asking for it. There is a term in the disability community called the polite ask. And so that's where someone's being asked to an event, asked to speak, but when they ask for the accommodations or to get paid, very politely, people get pissed off with them, thinking that they should be working for exposure. They're an advocate, so therefore they should be working for exposure, for opportunity, or for partnerships. Some people may choose to do that, and if you're a not-for-profit or quid pro quo, I will do that. But guys, the NDIS is all about economic participation. So it makes sense to pay those people who are disability advocates, disability educators, and disability communicators, decoding what it's like to be disabled, what keywords you need, what it's like being a support worker or working with a support worker. So, guys, I know this has been a bit of a long one, a bit of a ranty one, but guys, the channel's going to move more from the sit down talking heads to a vlogging one. And guys, I keep taking photos of my house, showing you how it's gone from clean to tidy with the support workers' help. But guys, I've realised I don't want to dox myself or dox my housemates. So guys, when they start going back to their activities during the year, may put some over on the blog. And guys, again, if you can like, share, subscribe, comment, that all helps me to be seen. And my goal for the year is to get to YouTube monetized as well. So guys, I will see you in the next video.